It's interesting. Everybody's talking about the antimicrobial resistance these days, and maybe because of the latest O'Neill's report. So it's very difficult to say something original about it. As an economist, as a health economist, probably I would advise to consider both demand side as well as supply side policies and interventions. What I mean by that is that, of course, in AMR, there is a supply side issue in terms of who is producing what, why pharmaceutical companies are not producing the new antibiotics that we may need. But there is also another supply side aspect which has to do with prescribers, why physicians are prescribing the way they are. You know, how easy it has got in some parts of the world to access antibiotics without being a need for antibiotics. And that is where probably you would need to work with prescribers as well as with pharmaceutical companies on the supply side. And then there is the demand side. Why are people over-consuming antibiotics? What's the drive? What are the drives for that? You know that especially I work in low-income countries, in low-income settings, and in low-income settings, if you go to a physician and he doesn't prescribe something, he doesn't prescribe the drug, you don't come away with the prescription. That is not, doesn't really count as a visit. So you would probably have to work with the demand side and try to address that unrequested demand for antibiotics, for drugs. So it's, again, you need a combination. You will probably need a combination of supply side as well as demand side policies and interventions.
I believe that we need policies worldwide which are going to prevent the sale of over-the-counter supply of antibiotics. For example, in countries like India, you can actually go and buy drugs that treat tuberculosis over the counter, which is really quite shocking. No prescription is required. This not only adds to the problem of how these drugs are utilized by the general public, but also it adds to the driving of resistances in bacteria towards these drugs. So that's one of the things. The second thing I think that's really important is the education of the prescribers and the consumers. So I think we need policies which are actually going to stress some detailed policies about what's the most important aspects of antimicrobials that the prescribers and the consumers need to understand. You know, some really take-home messages about prescribing and about use of antimicrobials. We really need some strong policies around this. And this can only work if these are developed globally and utilized and implemented globally as well. And then the outcomes are measured to see how this is working.
So for me, the problem of antimicrobial resistance is to some extent a natural occurrence and therefore also inevitable. There's a lot, I think, that we can and should do to try to preserve the medicines that we have, but ultimately it's also going to come down to developing new medicines. The problem that we face is that the companies that usually produce medicines aren't prioritizing these medicines at the moment for a number of complicated economic reasons. So there's a question of how do you get these companies more motivated to invest in new antimicrobials. In our efforts to think through how we might do this, we've actually found that there's a very different area of government policy where there's a very similar problem. So when it comes to developing medicines against quite unusual biosecurity threats like bioterrorism or pandemics, there also aren't very many strong economic arguments for companies to invest. Yet we've developed an infrastructure over the past 10 years where it has been able to gradually persuade companies through a variety of financial, economic, and regulatory incentives to become more active in this area. So I think what we really need to do is look at those lessons much more closely, tease them out, and see how we can apply them also to the problem of antimicrobial resistance.
I think the main policy I would advocate would be education of healthcare professionals, and that includes the nurses, doctors, and pharmacists and other people involved in the supply chain, I suppose, to ensure that they develop the correct prescribing competencies and ensure that antimicrobials are prescribed when they're needed. However, the education of consumers is very important as well, because we know that consumers need to be educated on the appropriate use of antimicrobials, managing their expectations. But you've asked about AMR globally, and if you think about it globally, particularly in the global south, we need to reinforce the regulations that underpin the sale and supply of medicines, ensuring that people do not go into pharmacies or other outlets to purchase antibiotics. And I think this focus on education and the focus on regulation will ensure that the few molecules we have left, which are effective antimicrobials, will remain so.
Well, I think for global policies to work well, people have to see them as being just as well as sustainable. And in terms of the justice, these days most people, no matter where they live, feel that access to antibiotics when they fall ill or the child falls ill is a right. So we have to have policies that address that question of access to antibiotics, as well as the problems of overuse or the emergence of resistance.
I'm actually not sure that pharmaceutical policies will be the main component of the policy package we need. I think important other policies will have to address issues such as the use of antibiotics and infection control. And I also think that a lot of these policies will probably not have to be global, given that a lot of the drivers of antimicrobial resistance are very much embedded in local contexts. But we do need new antibiotics, there's no question about it. The problem is that while we need new antibiotics, we don't want to use them. So this presents a very challenging situation for our current model of medical innovation, which is based on commercial incentives. So we are essentially asking pharmaceutical companies to produce a product that they are then not allowed to sell. In this context, I think it will be imperative that public sector organizations are investing much more heavily in the development of new antibiotics, not just in terms of funding, but actually building capacity for late-stage development and manufacturing.
Well, the way I would begin to address this problem is one of ultimately of individual behavior, of people taking their medicines correctly in the right dosage at the right time and being followed up by competent health professionals in the context of solid and sustainable health systems. So I would emphasize the importance of delivery systems. So systems that are sustainable, that are strong and able to educate people to in their behaviors in terms of how they deal with medicines. So ultimately, this is a problem of individual behavior. It's also a question of community involvement. There's been plenty of research that shows that community-centered approaches, and particularly the role of community health workers in low and middle income countries, and the importance they can have in enabling and educating people to in their relationship with medicines, and how that can help to address some of the incorrect or kind of not so desirable behaviors that lead to AMR.
I think there's two policies which are actually interlinked. The first one being antibiotic stewardship, educating to reduce demand so that the public have an awareness of the problems, and then also making sure that we're choosing the right antibiotic for the right bacteria and we're not using them inappropriately for viral infections, and moving from broad spectrum antibiotics to narrow spectrum antibiotics. I think the other thing that's actually linked into that is actually access to antibiotics. So we're controlling access by making sure that they are only available from appropriate outlets. So you can't buy them in the groceries. You can't buy them unregulated from pharmacies, and that we monitor and control their use in animal husbandry. So we're not actually using them as growth promoters. We're using them when there is a disease that needs to be treated. And again, we are using narrow spectrum antibiotics rather than broad spectrum antibiotics, and perhaps we need to look at the way we use them in food production and way food is actually produced, so that large condensed populations of animals where disease can spread easily, we might need to reconsider that, which would reduce the need perhaps for antibiotics.
Well, I have a health systems background. A lot of my research has been with the private health sector. I look at the supply side. I look at providers who are the conduits for antibiotics for the majority of the population. And I live and work in India, so I'll be talking a lot about that. But even if we look at data from other countries, from other low and middle income countries, we know that a very large proportion of medicines are provided by the private sector, not even the formal private sector. It is an informal group of providers who are quite heterogeneous, but they do use all kinds of biomedical drugs and formulations, including antibiotics. And in India, as many as 70 to 90% of all health encounters, especially in rural communities, happen with these kind of informal providers. And of course, antibiotics are used inappropriately. So if you were to ask me, I would say that this is the place to begin, and begin in a very realistic way, acknowledging that there are legal issues to be addressed, acknowledging that there are lots of other barriers which might come. The opposition to working with these kind of informal providers will be there in the medical community. But I think we need to address all of these issues and develop not just policies, but also actions arising out of these policies, which can enable both access to good antibiotics and also curbing the excess of antibiotics.
Yeah, I think the issue of AMR, antimicrobial resistance, is a really growing issue in the area of international health security. And I think one important approach that we can take forward in dealing with this threat is really to learn from successful collaborations between nations in dealing with this threat in the past. And also, hopefully this can not only give us a platform for further cooperation between countries in other areas of the world, but also to maybe provide a platform for international collaboration.
The point I want to make is that in order to combat antimicrobial resistance, it's not just a matter of pharmaceutical policies. One of the most important interventions is about public health. We know that one of the major sources of antimicrobial resistance is the rate of infection. The more often people get infections, the more you use antibiotics and the more resistance will happen. Therefore, a very important intervention in terms of combating antimicrobial resistance is to implement basic public health, such as clean water and other activities to prevent the transmission of infection. And that's as important as pharmaceutical policies.